Everyone. My name is Darshan Mehta. I'm the Education Director at the Osher Center for Integrative Medicine at Brigham and Women's Hospital and Harvard Medical School, and the Medical Director at the Benson Henry Institute for Mind-Body Medicine. We wanted to welcome you to our Integrative Medicine Grand Rounds. And just a few logistics before we begin our presentation for this morning. First, if you are requesting CME credit, you saw the slide that came up, as well as the event post on oshercenter.org for email request instructions. And importantly, just to request your CME credit by 8:30 this morning. We are really honored and really happy to have our colleagues present today. And I just want to take a moment to introduce them. This is a team of colleagues, Anna Maria Vranceanu, Ryan Mace, Gretchen Reynolds, Joel Salinas, and we are grateful to have our patient here as well, Emmy, who are going to present on a novel mind-body program for promoting brain health. Each of their bios are quite extensive, but I will just quickly summarize. Dr. Vranceanu is a clinical health scientist, associate professor of psychology and psychiatry at Harvard Medical School, and founding director of the Integrated Brain Health Clinical and Research Program at MGH. Gretchen Reynolds is a clinical neurologist at Brigham and Women's Hospital, who divides her time among clinical work and research with interest in dementia, movement disorders, mindfulness, and healthy aging. Ryan Mace is a clinical psychologist who is currently now a postdoc research fellow at MGH at the Integrated Brain Health Clinical Research Program. And then Joel Salinas is the Lulu and David P. Levitt Assistant Professor of Neurology, Department of Neurology, Center for Cognitive Neurology. He completed his residency at MGH and Brigham and Women's, and now at NYU Langone Medical Center. So with that, I will turn it over to Ryan to begin.
Thank you, Darshan. Allow me to share my screen.
As Ryan is doing that, just for all of our attendees today, just a brief mention that as questions arise, please go ahead and put them in the Q&A portion, and we will field them at the end of the presentation.
Darshan, when you took over for presenter, it removed my option to share the screen. Do you have a sense of where I can go to do so? Oops, I think your mic is muted.
It says all panelists should be able to share.
Let me see. Let me close the presenter view.
Ryan, I can make you the host now, and that might help you share. You might just have to make the next person.
I think that's it. Thank you.
No worries.
Here we go. Okay. Apologize for the delay, everybody. Thank you for your patience. Okay. Is the PowerPoint visible now?
Yes.
Excellent. All right, let's begin. Dr. Vranceanu, would you like to take it from here?
Absolutely. Thank you so much, Darshan, for the lovely introduction, and thanks everyone for having us here. We're truly honored to present on our My Healthy Brain program. Next slide, Brian. So to continue on Darshan's introduction, I'm a clinical health psychologist. I developed the My Healthy Brain program along with the team at the Integrated Brain Health Clinical and Research Program. I'm also principal investigator on a newly awarded Osher grant, which will optimize the My Healthy Brain program. Dr. Ryan Mace is currently a clinical psychology postdoc. He was a study clinician as a practicum student about 2 years ago, and he's also a co-PI on the OSHA grant. Dr. Gretchen Reynolds is a clinical neuropsychologist, and as a practicum student and postdoc, he was also a study clinician on the My Healthy Brain program. And Dr. Joel Salinas is a neurologist who referred participants to the My Healthy Brain program. And many, many thanks to Miss Amy Howe for being here today as our My Healthy Brain participant. Next slide, please. We don't have any conflicts of interest, but we do want to acknowledge funding from the Henry and Allison McCann Center for Brain Health, as well as more recently from the OSHA Center for Integrative Medicine through the Pilot Research Grant Program. Next slide. So in our time together, I will start by briefly describing the Integrated Brain Health Clinical and Research Program where we developed the My Healthy Brain program, and then provide an overview of brain health and why it's important. Next, I'm going to pass the baton to Dr. Ryan Mace, who will describe the My Healthy Brain program and preliminary findings from the open pilot trial. We will also hear from Dr. Gretchen Reynolds, who will talk about her views on the program, both as a study clinician and as a neuropsychologist. Next, Miss Amy Howe will share her experiences as a group participant, and Dr. Joel Salinas will discuss his perspective as a neurologist. Next, Dr. Ryan Mace will talk about the OSHA pilot grant and what we hope to accomplish over the next year. And I will end by talking about our vision for My Healthy Brain program, and we'll also have questions and answers. Next slide, please. So the Integrated Brain Health Clinical and Research Program conducts clinical work, research, and training of clinical psychology interns, postdoctoral fellows, and junior faculty across disciplines. Our research aims to optimize brain health and well-being through novel mind, body, and lifestyle interventions for people on the continuum from health to illness. We use the biopsychosocial model to account for the interrelation between biological, psychological, and social factors. We develop interventions with multidisciplinary feedback, not only from patients and their care partners, but from all stakeholders that are involved in patient care. As much as possible, we use telehealth and web-based applications to bypass barriers to care, and wearables to reinforce the development of new behaviors and more objectively measure outcomes. Next slide, please. So why are we talking about brain health? Well, about 10 years ago, our biggest concern used to be cancer or heart disease. Now, our biggest concern, and this is true for individuals across all ages, is brain disease. And if we think about what the brain does, this concern makes a lot of sense. The brain is truly the central organ of the body. It organizes and controls everything that happens in the body, from our sensory experiences to the decision-making. It regulates our energy, our productivity, our emotions, our creativity, our social relationships, and above all, our health, our performance, and our well-being. Next slide, please. So what is brain health? Our working definition of brain health includes not only the physiological and metabolic health of the brain as an organ, but also the dynamic interaction between the brain, the mind, the body, and the environment. So this includes our cognitive function, our ability to learn, to remember, our emotional function, our ability to maintain mental health or stay resilient during challenging times, and our physical function, our ability to engage in activities of daily living. Next slide. So over the past decade, we have noticed a paradigm shift in how we conceptualize brain health and brain disease. We used to think that brain health means absence of disease. Now we know that brain health also means enhanced brain performance. We used to think that losing brain function is a normal part of aging, and now we know that we can actually maintain brain function as we age. We used to think that brain health is biologically driven and static. So we're dealt a set of cards, a set of genes, and these genes will completely determine our brain health. Now we know that brain health is modifiable and we can override our biology. We used to focus on treatment of disease. So we used to wait until symptoms develop before engaging in treatment. Now we know that it's very important to focus on brain disease prevention and optimization, similarly to what happens now in the field of cancer or heart disease. So we can think of biology as the clay that we mold through our lifestyle, experiences, and environment. Next slide, please. So how do we do that? How do we preserve our brain health? Well, there are three core mechanisms. The first one is neuroplasticity, which is the brain's ability to reorganize and rebuild itself by forming new connections. The more pathways, the more connections the brain has, the more resilient the brain becomes. If certain pathways or networks become damaged, other pathways can take over. So we can think of neuroplasticity as a way that our brain is constantly changing. So everything we think, everything we feel, everything we do, from the things we eat to our level of activity, to how we interact with others, they're constantly and actively changing our brain. So we have much more control over our brain health than we initially thought. Neurogenesis is the process of building or creating new neurons. And we used to think that we're born with a certain number of neurons, but now we know that we could actually grow neurons across our lifespan. And exercise combined with cognitive stimulation is one of the best ways to grow new neurons. And finally, neuroinflammation. So inflammation is actually a good thing. It's the body's first defense to injury or infection. It normally shuts down after healing occurs, but lifestyle factors such as smoking or a bad diet or being sedentary can lead to chronic inflammation. And when this happens in the brain, it manifests as fatigue, brain fog, as well as cognitive decline. Lifestyle factors can also reverse or prevent neuroinflammation. So through these three mechanisms, we have an opportunity to optimize our brain health across our lifespan. Next slide. So how can we do that? So there are several pillars of brain health. And in 2017, the Journal of American Medical Association published a seminal article on what is the highest level of evidence for the lifestyle factors. So now we know that physical activity, social engagement, medical care, so taking care of your heart, reducing alcohol and smoking, and correcting hearing loss, maintaining good mental health, engaging in intellectual stimulation, having good sleep are very, very important. They have a high level of evidence for brain health. We also know that diet is really important, although we have a lot more work to do to understand which type of diet, although for now, the Mediterranean diet seems to be the most recommended. So when this article came out, we were really excited and tried to find an intervention that addresses all these factors, and we couldn't find one. So there are interventions that address physical activity or diet or sleep, but not all these factors. And so in response to this unmet need, we developed the My Healthy Brain program, which Dr. Mace will tell us more about.
Thank you, Dr. Vranceanu. So along with Dr. Reynolds, I served as a group leader for the My Healthy Brain program, and now I'm thrilled by the opportunity to introduce the program to you today. The My Healthy Brain program is an 8-week lifestyle group that targets the modifiable risk factors for brain disease. Our guiding hypothesis in developing this program is that building a lifestyle on the pillars of brain health that Dr. Vranceanu introduced can reduce or delay the deleterious effects of both age and neurodegenerative decline. The focus here being on the modifiable factors rather than the static risk factors such as age or pre-existing life course that patients come in that we have a lot less ability to change and mold as clinicians. My Healthy Brain was developed for adults who are broadly interested in promoting their own brain health. But research suggests that patients who have some level of elevated risk for brain disease, whether this is based on a family history, genetics, or cognitive concerns, may particularly benefit from participating in the program. The table on the right-hand side outlines the session topics. The program begins with an overview of brain health and evidence-based strategies for forming new lifestyle habits. Then each remaining session is dedicated to one pillar of brain health, such as sleep, physical activity, or diet. Participants end the program by establishing an individualized plan to maintain their progress in the long term for the rest of their life. Sessions are primarily focused on brain health education and practicing cognitive behavioral skills for lifestyle modification. In addition to learning these general skills that undercut multiple behavior change, participants learn strategies for specific lifestyle factors, such as activity pacing for increasing physical activity, or maintaining logs for diet and sleep changes. The remaining time is allocated to reviewing between session practice and problem solving any barriers to changing their lifestyle that come up between sessions. At the end of each session, participants set a SMART goal for homework to improve a lifestyle risk factor that doesn't come from the group leaders like myself, but is actually identified by the patients themselves and the referring provider. I'm excited to share some preliminary data in support of the My Healthy Brain program used in clinical practice based on what we have so far. The goal of this first pilot was consistent with guidelines for early intervention development. So specifically here, we are looking at initial markers of feasibility, as well as some signals of improvement and outcomes of brain health associated with the program. For this pilot, we enrolled MGH patients who were referred by their neurologist at the McCant Center for Brain Health, who were interested in modifying their risk for brain disease. They had to be at least age 40 and had some elevated risk factors. So they may have been had a sedentary lifestyle, had identified poor sleep quality, or were not adhering to dietary recommendations by their doctor. And these criteria that you see here, we believe are relatively inclusive for patients and generally consistent with similar brain health trials as of late. Patients were screened for eligibility before participating in the 8-week My Healthy Brain program, delivered by a psychology intern or postdoctoral fellow like Dr. Reynolds or myself. Patients completed baseline and post-intervention assessments online via the Partners REDCap system, and they could also complete them via paper and pencil in person. We collected data on a range of lifestyle behaviors as well as some potential psychosocial mechanisms of change to examine pre-post improvements in brain health as a result of the program. So we screened 71% of the patients initially referred by their neurologist, and 75% of those patients eventually enrolled in our program. Among those patients who enrolled, 75% or 24 patients completed the baseline measures, leaving us with a final sample of 18 participants or 75% who attended at least 6 of the 8 sessions and completed post-test data on REDCap. So taken together, this shows promise in meeting all of the feasibility and acceptability benchmarks that we set before conducting this study that are consistent with other intervention development guidelines. So everybody loves seeing these big randomized controlled trials, but they can be costly. And meeting these benchmarks before moving on to larger trials is critical because at this stage, we want to really make sure that patients are interested in signing up, it's not too burdensome, they're able to attend the sessions, and that the program material is right size for what they're looking for in treatment. Just to give you a brief thumbnail sketch of our sample, at baseline, the average age was 66, and about 2/3 of the participants were women. Similar to other studies conducted here at MGH, the sample was majority white and highly educated. And this points to the need to recruit and include more diverse samples in future phases of My Healthy Brain research. In fact, our patient, Emmy, will echo this point as well in her upcoming portion. And of note, depression was commonly reported among participants at the outset of group, which I believe plays into some of the outcomes that I'd like to share now. So here you have some pretty busy looking graphs, but allow me to walk you through them. These are spaghetti plots that visualize changes in outcomes over time during the intervention. The colored lines that you see there represent progress for each individual patient, while the dark dashed line represents the average change before and after the My Healthy Brain program. So here you see our outcomes for lifestyle behaviors relevant to the intervention. And participants reported medium improvements in physical activity in the top left, as well as sleep quality in the top right, as well as small to medium improvements in alcohol use in the bottom right. Now, nutrition was our only unexpected finding here in the bottom left. However, the measure had poor internal consistency, which limits its interpretability here. In future studies, we will need a nutrition measure that better captures the Mediterranean diet that Dr. Vranceanu mentioned, which is really what the program teaches. This process of enhancing our measurement illustrates the need for early iteration while testing new interventions like My Healthy Brain. We also saw small to medium improvements in anxiety in the top left, depression in the top right, increased sense of independence in the bottom left, and overall life satisfaction in the bottom right. So as I mentioned earlier, comorbid mental health concerns, particularly depression in this case, were common at baseline among My Healthy Brain patients. The program does offer education on the role of chronic stress in long-term brain health, and patients also learn relaxation strategies. Engagement in positive lifestyle behaviors and the group support and talking to other people, as Emmy mentions later on, may have also enhanced mental health during the program course. And lastly, with outcomes, the My Healthy Brain program was associated with small to medium increases in general self-efficacy on the left, as well as health competency more specifically on the right-hand side. We think this may reflect a newfound sense of agency to improve brain health as a result of the education and lifestyle changes taught by the program. We also think that this shows some promise for potential mechanisms like self-determination, self-efficacy, and sense of purpose in future research when we begin to look at more mechanistic hypotheses with larger trials. Now I'd like to turn the mic over to Dr. Gretchen Reynolds to share her experience in the group as a neuropsychologist.
Thank you so much, Ryan. Thanks for having me, to you and your team for being such great collaborators, and then also to the Osher Center for having us here today. I know we're all really excited about it, myself included. And so I just want to take a few minutes to speak, kind of reflect on some of the points on this slide about the group experience from my perspective as a provider, group leader, and also kind of highlight both the value of the training part of this program and also the value of the interdisciplinary nature of this program. So just a little bit more background. I'm a clinical neuropsychologist and I have a strong interest in cognitive rehab and brain health. I see mostly adults and older adults for neuropsych evaluations. And then I also run some cognitive rehab groups that are based on goal management training. So these groups are really designed to focus and optimize attention and executive functioning. And so like Dr. Mace mentioned, I first collaborated with My Healthy Brain as a postdoctoral trainee, and I remember being so excited when I got the email about this program. Number one, because they were interested in collaborating with other disciplines, including neuropsychology. And number two, because as an adult-focused neuropsychologist, as I'm sure many of the physicians and providers in the audience kind of tend to, we recommend these healthy lifestyle behaviors to so many of our patients. And, you know, I see that for feedback or follow-up. But outside of that, I don't know how often they're actually doing these behaviors and actually maintaining them over time, which we know from the research studies is one of the biggest challenges. And so I was lucky to collaborate, lead some of the groups at MGH, and then continue running groups as a clinical service back at Brigham and Women's, which is where I'm now. And so just looking at some of the points on the slide, they really kind of resonate with some of the groups that I've led. And I think Dr. Mace touched upon some of this in the outcomes, but highlight things like the value of social support, weekly accountability, and also evidence-based dissemination of this brain health information, which I think is so needed right now. You can see some of the points highlight, you know, receiving positive reinforcement when we're trying to actually implement behavior change, which is hard. So that's a huge asset of the program. And then also this idea of being proactive and building up self-efficacy, which is captured nicely here, which kind of segues with the previous slide, but this idea being it's I'm much more likely to problem solve when I have roadblocks outside of class. And so being able to kind of foster this belief that we can execute certain actions, succeed in situations, I think is a huge piece of the program. As you can see, participants reported really high satisfaction. No adverse events at all were reported. And I just think it's really unique in that it has this kind of holistic approach to brain health. And as we kind of touched upon earlier, given this increasing focus on prevention, this is really, I think, more important now than ever. And then just last point from kind of, again, my experience as a neuropsychologist, many of the patients who complete other groups of mine are always asking for kind of other offerings, what other groups might be out there. And there really wasn't a lot of other offerings, I would say, a few years ago. And so as a provider, it's really exciting to be able to think about referring patients to a program like this with the hope of actually putting our recommendations into practice. So that's my experience as a provider, as a trainee, and just kind of really highlighting to how interdisciplinary this program is. And it's so well suited to kind of pooling all of our resources to kind of best support our patients. So I think I will stop there and just turn it back over to Ryan now to he'll introduce, I think, one of our most valued panelists for today.
Thank you, Dr. Reynolds. We really appreciate your input. And given that there are so many different pillars to brain health, it really does necessitate this interdisciplinary approach. And the My Healthy Brain program is truly stronger as a result of input from not only just psychology and neuropsychology, as well as neurology as well. Thank you. So now I am honored to introduce Emmy Howe for the patient perspective on brain health. Emmy completed the My Healthy Brain program with me after receiving a diagnosis of mild cognitive impairment in 2018. She also saw psychologist Dr. Ethan Lester for individual therapy with a focus on mindfulness-based interventions to complement her work in group. Emmy joins us today via Zoom in person and offers her experience via video clips. I will preface this by saying that some of the audio is a bit mismatched with the video, so please bear with us as we listen to Emmy speak. It will allow me. There we go.
Well, what had started happening was I have a lot of kids, and the oldest one, who's 34, started saying things like, "Mom, you weren't like this before," because people would just laugh when I lost stuff, or, you know, people would just let me thought that was like just me, and Maya would say, no, you weren't like that before. And my partner, Amy, noticed it as well. And so between the two of them, I think, you know, there were things that happened that I noticed that nobody else did. Like, instead of putting salad dressing in my salad, I put beer in my salad. And, you know, the things that we do, older people do anyway, but like putting a dish in the stove instead of the dishwasher. But it's like, you could feel so many of those things happening. And I also had a couple times thinking I was somewhere else than I really was, like especially skiing, like that I was somewhere else skiing than I was. So those were the main things. And I think I was just kind of falling back into the thing about this is the way this is going to be. Like, I would come home from work and just sit in the same place on the couch and just like look at my computer and try and just stay still and calm. And yeah, I just thought, yeah, I'm getting old. I was so happy to be able to talk about it, and so happy to be able to talk about it with other people who were having different problems, but the same problems, and all of us kind of trying to figure out what we do to help ourselves. So Ryan presented the Healthy Brain curriculum, and I don't remember the exact order, but it was really, really super useful. And the first thing I did that he suggested, I believe, was to change my sleep patterns, because I had been sleeping late a lot. And I think maybe it was kind of a depression that I've had all my life piled on to the brain issues. So I began to understand that what we were doing was giving our brain less work in the wrong places and more work in the right places. And also, so I made a regular sleep time. sense that you could eat things that would feed your brain, as opposed to usual diets that say, don't eat this and this and this. The other thing was exercise, and I usually exercise, but my knees have gone. I played soccer till I was 50, and so it made me just really start walking, and I still do walk about 7,000 steps a day. If I don't walk, like the 2 days before today, I didn't walk, and I could feel it. And so this morning when I knew I was meeting with Ryan, I said, I'm going to walk, and I walked. Probably about 4,000 steps, but that was super helpful. And the other thing that Ryan talked about that was really new to me and really important was the idea of growing your brain reserve. And I have been through DBT, dialectical behavior therapy, with my daughter twice as a parent. And so I understood the idea of trying to change habits and patterns. And so I started doing things that I used to do, like quilt making and drawing and painting. And I actually took a college class online in Abnormal Sight at Greenfield Community College. And I kind of embraced the idea of learning how to work on virtual platforms as a way to grow my brain. So everything, now I think about everything in life as, is this growing my brain? Like, is this an opportunity to grow my brain? And I think that at the end of our course, one of us asked Ryan if you could tell one thing to do. Just tell us the one gem to do, if that's all we can hold on to. And Ryan said, stay engaged. Don't quit your job till they push you out the door. So figure out ways to be supported in your job. Keep doing stuff. Keep being social. Ethan worked with me at first on just figuring out that I wasn't my diagnosis. He basically had me fill out a chart about how much of me is MPI. And the first part was the whole pie chart practically, except for this tiny little piece was MES MPI. By the time we finished the first session, MES MPI was like a little piece of pie in my pie chart. You know, I was back being grandma, I was back being college, I was back being artist, whatever, teacher, wife, mom. Then he said, let's do one of the activities at home, a mindfulness that we did in the office, and it was about appreciating our hands. And I was a woodworking teacher for 10 years, and I very much appreciate my hands. So that was a mindfulness thing that I could do. Another mindfulness thing that he had me do that I still do in different weeks is when you enter a room, you assess where you come from and where you're going at that transition. And that was, still is, and was a very grounding thing and helped me. And there are a lot of activities in that book that are useful. The one that I have kept with is non-dominant hand work. And I do non-dominant hand drawing every day for 7 to 10 minutes. I can't meditate without something to focus on. And I really actually can almost draw as well now with my left hand as my right hand after doing it for 2 years, or no, a year. What I did before, I did a lot of painting around some of the concepts. Another concept that Ethan introduced me to through that book was leave no trace. And I have to say that the idea of leaving no trace means you don't forget your stuff that in that other room, or in your office when you're coming home, or whatever. If you leave no trace, you take everything you had with you. And behind my head, there's a painting, it's white, and that's my leave no trace painting. So Ethan introduced me to those things, and basically I have been able to keep doing them. And when my
here is artwork that Emmy graciously shared that she created in response to her brain health treatment.
Pretty much been able to maintain sleep, diet, exercise, and growing my brain reserve. I mean, I think that I've been able, sometimes I fall off, but mostly that's worked. And I think, you know, I think that the whole concept of being able to grow your brain reserve has just become like a focus for me. So I applied to Expressive Therapies program because the hardest thing for me is when too many things are going on. So being the director of a project that works on 4 platforms has both been a challenge that has grown my brain, but I have to get more focused. The other big challenge is finding another group. I joined a dual diagnosis group, and those people, most of them are really struggling with mental health issues on top of the MCI diagnosis, really hard. And I think the other thing that I hope for My Healthy Brain is that it goes out into poorer communities and into communities of color, because I think that the way it's set up is really powerful and impactful and would be effective in those areas. So, thank you.
Thank you, Emmy. We really are grateful for you sharing your experience with us about the My Healthy Brain program and truly speaking to the importance of brain health better than any of us truly could from the patient's perspective. Thank you for joining us. Now I'd like to introduce Dr. Joel Salinas to share his perspective from the side of neurology.
Thank you, Ryan. So I would say that as a neurologist, kind of going through my training, one of the things that I really I've found myself noticing quite a lot and being troubled with was how all the people that we were caring for in the hospitals and in the clinics were people who were kind of in the later stages of a long disease course that had been going on for decades. And when you try to figure out kind of how to solve an issue, you want to go to the root causes. And I kept on looking towards kind of earlier and earlier in the disease course, kind of moving further upstream into kind of what are the things that are leading to someone's current condition. And a lot of it seemed to relate to not just kind of societal and environmental factors, which are far upstream, but kind of the behavioral factors that really come into play that relates to someone's lifestyle. And in clinic, one of the things that felt very frustrating is that we would often give recommendations about kind of do more exercise, eat healthier, and it never really felt like any of those recommendations had any teeth to them, because they all seemed kind of like wishful thinking or actually just stating the obvious, which would only really raise the sense of frustration and helplessness on the side of the patient and the family. And so one of the things that I was really excited about becoming a part of the McCann Center for Brain Health at NGH was to help develop kind of the initial stages of this brain health clinic that would really focus on identifying risk factors and then working in interventions to help to reduce those risk factors and enhance protective factors that were at play. And the My Healthy Brain program really brought in this interdisciplinary approach that could help make those changes possible with long follow-up. And so as the neurologist that saw Emmy, I was really glad. It's kind of almost kind of the counterfactual what often happens in clinics, where you give a diagnosis of something like mild cognitive impairment, which can really change a person's life, especially if there isn't any clear kind of reversible causes to work on. But rather than saying, I wish we had a cure, I could say, well, here is some options that we can have for you to help to actually empower the patient and help to kind of put a lot of these these different factors into their own control, and that in of itself kind of begins to create a virtuous cycle to help kind of reduce the risk factors, enhance protective factors, and in the end, what it really ends up doing is putting the odds in the favor of the patient and the family, the people that they care about, to be able to preserve their cognitive functioning for as long as possible. The other thing that I think is important to note here is kind of what this process looks like from the patient side to become a patient seen in the brain health clinic. So essentially, people would either be referred to us by the neurologist, the primary care doctor, or find us online. And so if you were to just Google MGH brain health, you would find our website at the top of the link. But people would often just give us a call. That number was 617-726-4881. And you'll find that on the website again. But once a patient gives a phone call, they speak with one of our coordinators, who then would do a very brief kind of intake or screening to kind of get a sense of what the person's needs were. And from there, they would be kind of triaged. And so patients that were reaching out with an active issue that was significantly impairing their life, those people would be referred to first a primary kind of neurologist to help kind of manage and follow that issue longitudinally. And then once they have that primary neurologist, they would come to us as kind of the complementary kind of approach. If the person had mild symptoms or questionable symptoms, and they'd been seeing somebody before, or the symptoms were just mild enough that it wasn't significantly impairing their day-to-day functioning, then they would qualify to be seen within the clinic. And then at that point, they would be scheduled to see one of our clinicians. Right now, the current head of the clinical side of the Brain Health Center is Dr. Zina El-Shamali, now that I've moved over to NYU Langone in my new position. But you would be seen by this clinician who would do a very thorough intake, kind of hearing your story, hearing very specific, asking very specific questions, doing a very in-depth neurological and neuropsychiatric screening, and then from there, kind of helping to really encapsulate and quantify those risk and protective factors, giving then recommendations to follow up with that. And one of those recommendations might have been referral to the My Healthy Brain program. And then from there, we would follow up at least once a year, perhaps sooner depending on any issues, but the goal was to kind of see us as kind of like a primary care doctor for your brain.
Thank you, Dr. Salinas. So as a My Healthy Brain clinician, I felt rest assured that the neurologists in the McCann Center did that thorough assessment and made some very specific recommendations for the lifestyle factors to start modifying from day one of the program. And it was also really great to know, too, that there would be a longer-term follow-up long after the patient had completed the My Healthy Brain program. Thank you for your perspective. So the data and the lessons learned thus far in this presentation stem from only phase 1 of the My Healthy Brain development. Now, Dr. Vranceanu and I are excited to share the short and the long-term vision of the program. With the Osher Center pilot research grant, we will conduct a mixed method study to further enhance and pilot the My Healthy Brain program. In the future, in the near future, the results will inform my K-23 application to the NIH to test the feasibility of the enhanced My Healthy Brain program against a health education control. So as a team, we are very interested in the future of this program moving forward and continuing to offer it for patients. And this framework of iteration that we've been hinting on throughout this presentation is consistent with evidence-based frameworks for developing novel interventions in clinical practice. We will begin aim 1 of the Osher pilot grant starting this September. The first step will be to seek feedback from multidisciplinary experts, such as the panelists in this presentation, and a patient focus group to enhance the program further. Our primary goal is to explore the novel integration of mindfulness skills as well as behavioral principles to further promote lifestyle modifications for brain health. Building on Emmy's experience, as well as the relevant literature, we believe that mindfulness offers immense potential as part or one component of a brain health program. So several benefits may include tolerating changes and uncertainty with the aging process, increasing awareness of negative behavioral patterns, and decreasing urges that maintain unhealthy habits or the status quo. Mindfulness in and of itself also directly contributes to brain health through multiple pathways identified in the research, such as buffering against chronic stress, increasing brain functional connectivity, strengthening the structure of the brain, and also enhancing cognitive performance. In AIM 2, we will conduct an open pilot with exit interviews from patients after completing the program to explore the feasibility of the enhanced My Healthy Brain, as well as its association with improvement in brain health outcomes. We will also incorporate smartphone logs and actigraph watches that you see on the right-hand side to further track and reinforce skills in real time as participants progress through the program. These actigraph watches will also provide some passive monitoring to set the stage for some biomarker testing that may be amenable to influenced by the My Healthy Brain program. And now I'd like to reintroduce Dr. Anna Maria Vranceanu to conclude with our long-term vision.
So our long-term vision is to create a culture of brain healthy lifestyle with a focus on prevention. And we aim to do this through clinical work, research, and training. Unfortunately, in academic medical centers, we tend to separate the clinical work from research and training, which we think is limiting. Our vision is that these three components should cross-pollinate and inform each other over time. In terms of clinical vision, we're really excited to have Dr. Gretchen Reynolds offer the My Healthy Brain through the Osher Center at Brigham. We are also offering the My Healthy Brain program in the Cancer Center at Dana-Farber. We took a bit of a hiatus with COVID, but we are excited to return soon to the McCann Center and reoffer the My Healthy Brain program at MGH. We are also part of the Brain Health Initiative in the state of Florida, and we'll be offering the My Healthy Brain through this collaboration in the fall. And really the larger clinical vision is to incorporate My Healthy Brain within the multidisciplinary care systems nationally. In terms of research, as Dr. Mace mentioned, he will submit a K-23 at the end of this year. We are very much interested in efficacy testing through large multi-site trials. I saw a couple of questions about mechanisms of the My Healthy Brain, and we're very interested in looking at biological as well as psychological mechanisms. We would love to develop a brain health index so that we could really clearly identify and quantify risk for brain disease, as well as a comprehensive measure that assesses all the risk factors for brain disease. We would love to be able to bypass barriers to care through virtual platforms as well as mobile applications. We're interested in incorporating behavioral economics principles. We know how difficult it is to change lifestyle behaviors and how challenging it is to do that, or impossible to do it in a vacuum, that we really need to account for an individual's environment in making these changes. And very important, we want to make culturally sensitive modifications as well as numeracy and literacy modifications. And of course, we need to continue the training of the next generation of psychologists, neuropsychologists, and junior faculty from all disciplines in order to move forward the field of brain health. Both Dr. Mace and Dr. Reynolds delivered this program as trainees, and their own training has benefited tremendously from being part of this program. Next slide. So if you're interested in participating in this program or you'd like to make referrals, we will be starting the OSHA grant for My Healthy Brain program in the fall. So you can contact Dr. Ryan Mace. There's some eligibility criteria here. And we would love to acknowledge support with this presentation from Dr. Jonathan Greenberg and Ethan Lester, who are clinician on the My Healthy Brain program. They're both part of the Integrated Brain Health Clinical and Research Program. Dr. Emily Zale, who was one of the early postdocs working with me on developing the program. Drs. Jonathan Roseanne, Greg Ficcioni, and Christine Ritchie, who are OSHA pilot collaborators. The coordinators at the Integrated Brain Health Clinical and Research Program and the McCann Center, and our collaborator, the Brain Health Initiative in the state of Florida. So thank you so much, and we're ready for questions.
Okay, thank you, everyone. What a beautiful and very comprehensive presentation. Thank you again for Emmy for sharing your journey with all of us. And as you can tell, well, maybe I actually don't know if you can tell, but we have had over 100 people watch this through from start to the end. So obviously this is a topic of significant interest to our broader community. And again, so what I'd like to invite, I'm going to start off with a question, but the other folks, panelists can certainly answer live, type in the answers because we won't get to all of them. We have about 5 minutes for questions. So maybe I will ask the question and you can think about both from the research and clinical perspective. Given that the My Healthy Brain program is a multi-dimensional program, do you have any hypotheses clinically and from a research that one factor is like the secret ingredient, and you don't have to, do you have a sort of a sort of something that you're thinking about this and how you think about studying this, and that may address some of the questions that are already in the Q&A. But so I'll turn it over to maybe I'll ask Emmy first as a patient, and then if Emmy, if you can just take 30 seconds to answer, then we'll turn it to the the team.
Thanks for asking. I think one of the huge things was that the commitment of Ryan and Ethan to the idea that your brain can change. You know, those of us who are over 60 don't know about that stuff. I knew a little from DBT, but like they were these amazing cheerleaders. They basically saved my life. And I think also I had a motivation that I have a grandchild. So I think if you have your eyes on the prize, like who wouldn't want to change if you're not going to be able to think straight in 5 years? But it was a lot knowing the new things about brain health that Ryan and Ethan conveyed to us so clearly and made us so optimistic about our own self-care.
Thank you for those kind words, Emmy. I can follow up to what you mentioned here. And as a researcher, you know, and a clinician, we did hear a lot about this enhanced sense of purpose and self-efficacy. And while we kind of captured that in the pilot, I think we really need to quantify this moving forward as a really leading mechanism of change. I think as far as the lifestyle factors go, you know, I did my dissertation on the brain health benefits of cardiorespiratory fitness or exercise. So I spent a lot of time researching this area in graduate school. And I think that the meta-analytical evidence is showing that physical activity is the number one. If you could pick one lifestyle change to make, it would be physical activity for a number of reasons. It kind of hits all of those mechanisms that Anna Maria mentioned. It pumps blood and oxygen to the brain, and it also reduces other risk factors such as heart disease, stroke, hypertension, diabetes, etc. So I think if we had to pick a primary outcome, it would be physical activity, with the remaining pillars of brain health being as secondary outcomes.
And to add to what Ryan said, I think what we're noticing clinically and perhaps in our own lives is that if you focus on one lifestyle factors, the others kind of go together, right? So you exercise, you sleep better, your diet will change as well. I think we used to think that cognitive stimulation is really sort of the best thing that you can do for your brain. And we're actually learning that, you know, if you do Sudoku, you're going to get better at doing Sudoku, but that's not necessarily going to generalize to the rest of your life. And so combining cognitive stimulation with exercise, maybe going on a hike on maybe a different path with a group of friends, where you're really engaging your social support as well, and doing some cognitive stimulation and physical activity is probably the best way to go. But there's a lot that we don't know, and we're really, really excited to actually start doing the research.
So quick, in terms of thoughts of the costs of the program, insurance coverage, for some of the people who are clinicians in the amongst the attendees, wondering like, how do we get people there?
Yeah, so I think we're starting to figure that out. Gretchen, I don't know if you can speak to what happens at the Osher Center. I think there's no reason why insurance shouldn't, you know, cover this, given the emerging evidence.
Yeah, so I've done it at Brigham and Women's. I haven't done it at Osher yet. And the other groups that I run there, we typically bill it as group therapy. So as long as that's covered by the insurance, we check that before to make sure. There might be copays depending upon the coverage, but we check that beforehand for everybody.
Another question that came up was, you know, in terms of training, have you started ways for people to be trained in the model?
So we, in the Integrated Brain Health Clinical and Research Program, we train clinical psychology interns who are part of the internship, as well as postdoctoral fellows and junior faculty who reach out to us to develop collaborations. We're not there yet to develop, you know, an actual training program for clinicians. You know, we have still a lot of work to do, but we're very open to collaborations. You reach out to Ryan or myself, you know, and we're happy to share the program and you know, expand it.
And then I'll just point out to everyone, those whose questions have not been answered, Ryan's email is right there, and I'm volunteering Ryan's email as a point of reference for follow-up questions as needed. But last question is if you can just say, what is your vision for recruitment around just thinking about communities of color, marginalized or disadvantaged populations as well?
Yeah, so this is really, really important, and it's really part of our vision. Obviously, we'll have to adapt the program to make sure that is really generalizable and applies to you know, people in, you know, all environments. We do have, as part of our vision, plans to make adaptations and start collaborating with the Boston Medical Center in particular, you know, where we would be able to have access to more racially and ethnically diverse individuals to really be able to do the work.
Great. Thank you again. Once again, thank you to the entire team for presenting, and especially thank you to Emmy for really sharing your journey with all of us. Really, this was a wonderful presentation, and again, obviously to be continued, and we look forward to seeing the next evolution of this awesome pathway that you embarked upon. I just wanted to, before we conclude here, I just want to let everyone know this is, again, if this is the excitement of our Osher Center Grand Rounds, is that we can have these types of really awesome discussions, and our next month continues to, I think, on this path of excitement. Our presentations by Dr. Christine Gertz at Duke University School of Medicine, and she's going to be talking about non-pharmacologic approaches to pain management, lessons learned from pragmatic trials of chiropractic care for back pain. And then just to all of you who are here, please do register for our amazing Integrated Medicine Network Forum, which is the theme is learning vertically and horizontally. And we're really addressing issues around diversity, inclusion, interdisciplinary and multidisciplinary education, and resilience. And this is really, I think, this will be on Friday, November 6th. Registration is live and open, and it is free. So we encourage all of you to really take part in this amazing day-long event, and we look forward to having your participation. So again, thank you to our presenters. If there are any questions, please reach out to the Osher Center. We will have this presentation up on our website in the upcoming week or so. So for those of you who want to review some of the slides or review the content, you will be able to do so. Okay, thank you again, everyone, to our presenters, and we look forward to continued conversations.
Many thanks for having us.
Thank you.